Joining us right now to talk about what we're seeing in Washington, covering Health and Human Services, is Dr. Scott Gottlieb. He is the former FDA commissioner and a CNBC contributor who's also an Illumina and Pfizer board member. And Dr. Gottlieb, I want to talk to you a little bit today about what we saw last week in the hearings with RFK Jr. This was interesting because there were a lot of Republican senators who are really raising questions about the tactics that he's taking at this point. And I went through and was kind of watching some of these. Senator Barrasso from Wyoming is the second-ranking Republican in the Senate. He's also a doctor, and here's what he had to say on this. He had some comments. In fact, let's listen in. Republican senators expressing some dismay at Senator Kennedy's words at last week's hearings in front of the Finance Committee. We've heard from Senators Barrasso and Tillis in the hearing, and in fact, here's what they both had to say.
Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned.
I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that.
Senator Mike Rounds of South Dakota, for his part, told reporters, I'm telling my kids, I'm telling my family members and anybody who asks my opinion, get your vaccines. They have saved millions of lives. And when he was asked if he had second thoughts about voting to confirm Robert F. Kennedy Jr. as Health and Human Services Secretary, Rounds said, I think the president wanted him, and I think the president has to deal with him. That's a lot of voices, Dr. Gottlieb, who are now raising questions on the Republican side. And I just wonder how much tolerance the president, you think, will have for an agenda that may not necessarily reflect his own.
Yeah, look, I think the president seems to be supportive of Kennedy. I think what you're seeing on the Hill is mounting frustration around the moves on the pediatric vaccine schedule. I think a lot of people who had frustrations coming out of COVID about both the mandates as well as the disclosures of information around that vaccine, where people felt that the CDC was slow to service certain information, wanted some kind of reckoning, but they didn't want a reckoning around the pediatric vaccine schedule, which is what RFK seems to be after right now. I think a lot of the policy steps he's taken is setting up an outcome where he's going to try to restrict access to the pediatric vaccines. You're seeing on the Hill, there's not a lot of tolerance for that. And you heard the president's comments as well, affirming the importance of that pediatric schedule.
The president's comments, I think you're referring to when he was talking about Florida, where there is a movement afoot to say that there are no more mandatory vaccines, including for kids going to school. The president himself said, and I'm just looking for this at this point, you have some vaccines that are so incredible. He said this at the White House when he was asked about that effort in Florida. And I think you have to be very careful when you say that some people don't have to be vaccinated. I think you're right. There were a lot of questions about the COVID vaccine, people wondering how safe, especially for kids. Some questions, just going back, this was something that was done in a rush. Can we ask some of those questions without upending every vaccine that we've ever developed and put forward?
Yeah, look, and the president's comments reflect my conversations with him. I had many opportunities to talk to the president about vaccines, probably 6 in all, which is a lot of conversations for an FDA commissioner to be having with the president. He had good questions. He had some furtive concerns. He wanted to make sure we were looking at the data. He wanted to make sure we had good systems in place to monitor the safety of vaccines. Some of his questions were around the purported link between autism and the MMR vaccine, because there was a lot of stuff in the press. But the president always affirmed the importance of the pediatric schedule. And the few times that he went out and spoke publicly about this forcefully, it was always to encourage people to get vaccinated. During the 2019 outbreak of measles in New York City and the Orthodox community, the president went out and said it was very important for children to get that vaccine. During the 2018 flu season, when we had a very bad flu season, he went out and tried to encourage senior citizens to get vaccinated. So the president was always supportive. He had good questions. They were the kind of questions you would encounter with, a parent. But they were not the kinds of questions we're seeing raised by Secretary Kennedy. And I think Kennedy's at odds with both the president's ethos around these things and certainly members of the Senate.
What questions is Kennedy raising that are different, you think, than what President Trump raised?
Well, it's not the questions he's raising. It's the instruments he's putting in place to start restricting access to vaccines, getting control of the ACIP committee at CDC. He's going to put on the next agenda the hepatitis B vaccine. We all know he's looking at MMRV vaccine, trying to obviate use of the MMRV vaccine, which is measles, mumps, rubella, and varicella. I believe he's going to claim in his autism report that there's an association between alum, which is the adjuvant used in most pediatric vaccines, and autism, which is going to set in place a litigation enterprise against the vaccines to potentially bankrupt the vaccine injury compensation program. So that could take down the whole pediatric vaccine enterprise. And he's been very systematic, very methodical, frankly, very effective, putting in place the people and the tools he needs to try to effectuate this goal. Look, he is an avowed anti-vaxxer. He spent 2 decades doing this. Sometimes you have to take people at their word. I think this is a mission of his, and there really hasn't been a lot of pushback until now, and this is mostly rhetorical pushback. No one's really stopped him from implementing these instruments of control.
When you say bring down the entire pediatric vaccine schedule, what do you mean?
Well, look, if he makes a move to say that there is a purported link between alum and the entire pediatric schedule, that adjuvant used in about 10 vaccines is no good alternative. He could force the vaccine manufacturers to try to reformulate the vaccines, decouple them. So instead of having MMR, you have measles, mumps, and rubella separately. Remember, we're in a situation right now we're seeing declining vaccination rates. Last year, we had 35,000 cases of pertussis. The year before, it was 5,000. This year, we're expecting upwards of 75,000. So you're starting to see the vaccination rates declining, and you're starting to see the implications of that in terms of more disease. I think he's going to systematically go after, try to force manufacturers to reformulate and decouple some of these vaccines. One of the things they did in the COVID approval that was interesting was a contraindicated co-administration between the COVID vaccine and flu and RSV. And as you know, I'm on the board of Pfizer.
Right.
There's a lot of data showing that COVID could be safely administered with flu. In fact, the CDC website still recommends that. They created a new evidentiary standard they called substantial clinical benefit. They're saying you have to prove substantial clinical benefit in order to demonstrate that 2 vaccines could be co-administered. They did this in the context of COVID. If you extend this, not to an extreme, but just to sort of its logical next step, why wouldn't they call into question co-administration of the pediatric schedule and say you have to demonstrate that there's substantial benefit to co-administering these? If they did that...
There's a substantial benefit if you're a parent because you don't want your kid to get jabbed 4 times instead of 1 for the MMRV.
A lot of what we do with the pediatric schedule is to try to conform with the practice of pediatrics because you can only bring a baby back so many times for a well baby visit. If they start to decouple these things and force a lot of more interactions with the healthcare system, it's going to put pressure on vaccination rates overall. Right. You want to get them over with, but it's going to cause a lot of people not to get those vaccines. Them at all. Yeah, they'll be lost to follow-up.
Scott, you bring up, you're on the board at Pfizer. Critics are going to say, oh, you're just saying this because you're defending Pfizer and defending their vaccine business. What's your response to that?
Well, look, a lot of what we're talking about here is not made by Pfizer. The only pediatric vaccine that Pfizer makes is the pneumonia vaccine. So if you look at alum, for example, it's in Hib, it's in meningitis, it's in hepatitis B, it's in a lot of other vaccines. It's not in that the Pfizer particular vaccines. Pfizer does make the COVID vaccine, but I think, frankly, we've kind of settled in an environment right now where that vaccine is largely going to be used by an older population. My biggest concern are the pediatric vaccines, MMR, pertussis, DTaP. That's what I think Kennedy's focusing on.
And for the Republicans who are raising questions, and again, it's also been Senator Cassidy from Louisiana, a Republican, who's a doctor, and Barrasso, who is not only the second-ranking Republican in the Senate, but a doctor. With them raising questions, does that change the stakes?
I don't think it changes the stakes a whole lot, quite frankly. I think this really needs to be from the White House, and the question is, where is the president on a lot of these things? It certainly puts pressure on the secretary. I think potentially it slows them down a little bit, makes them think twice about doing things like firing the CDC director, things that are very visible. But a lot of what's happening that's going to be most impactful is this stuff underneath the radar, what I'm talking about now, the alum, and declaring that it's the cause of autism.
I was just going to ask you, politically, do you think that RFK is going to remain in this job for the duration of Trump's term?
I think he's going to remain in the job as long as he wants, quite frankly. I don't see any real groundswell in the White House from what I'm hearing that RFK, is an albatross around the administration, needs to leave.
Except that I don't think that they like some of the vaccine, except that they seem to be at odds on some of the vaccine stuff a little bit, but maybe they're really not at odds.
Yeah, but so look at talc. So FDA held panels on talc trying to link talc to certain chronic diseases. They backed off that immediately because a lot of manufacturers went to the White House with concerns, and the White House, I think, encouraged RFK and others to back away from that. And it wasn't just the drug companies. These were cosmetic manufacturers. You could see situations where there's pressure to back off certain of these vectors. I think the vaccines, though, is so part and parcel to the Secretary's ethos. I have a hard time believing he's going to back away from there. And the other thing is that, that hearing was combative. But I think a lot of people go into hearings right now in this administration of the view that they do better when they're combative. I think he overreached a little. I think he overreached a little bit because I think showing disrespect, particularly to any member of Congress, but especially your own party, is risky. But that is the general posture of people who go before the Senate. Unfortunately, right now, that they feel that they need to be combative if they're going to be facing, a hostile hearing.